Hello, am I audible? Are you able to see the screen? If someone has joined, please do let me know. Okay, mine, doctor. Yes, definitely we are going to start at 12. And I said, okay, hello, Shoaib. Yeah, I am able to see a few of your names. So this is what we have actually planned. Okay, Dr. Sanjay. I think my voice is audible and let's wait for some time. I think 12 people have joined. We'll wait for some around 2 to 3 minutes and then we'll start the session. In the meantime, you can let me know, like, you can post your questions also in the chat box so that I can incorporate it. Firstly, we'll be looking into the upcoming MD examinations, how to approach regarding the answer writing skill, and regarding the Viva part also. And then we'll be moving forward regarding the preparation. Okay, how to prepare for the MD exams. And then we'll be moving into the another section which we have been like receiving quite a lot of messages from the residents regarding writing case reports and series. After that, we'll be looking into how and what we can do post MD. What are the various career options and various other degrees that could be done post MD. Okay. Mind doctor, actually, the topic of discussion has already been shared in the group. Also, have enlisted various type of. I have listed out the various topics that we'll be discussing today. I hope you are able to get it. Okay, fine. Dr. said we'll be covering that portion first, then we'll be looking into the case reports part. Okay, so shall we begin? Okay, fine. Let's start. So first we'll be discussing regarding the upcoming MD examinations, the approach, the answer writing, and also how to deal with the Viva part. Fine. So regarding the exams, the approach should be very much clear that you have a stipulated amount of time. It's around 2 months now. Some of you have started preparing before that also. However, in some of the colleges, the time frame is pretty less. So you get pretty restricted time frame for which you have to prepare your MD examination. So the approach has to be very much clear. The approach should be to crack the exam, to pass the exam, and also to pass it with fairly good amount of score. Okay, it is very much different from the MCQ examination. So we are all used to give a MCQ examination where the options are already given, and even if we miss a bit also, we are able to mark the correct answer based on some of the hints that are given in the options. But as far as MD exams are concerned, it's a theory exam, it's a pen and paper exam where you have to write the answer and you have to frame it in a proper manner so that the question which has been given is getting addressed. So that is why the next topic that we are discussing is the answer writing skill. So it is very commonly being noted among the residents that they find it very difficult to write an answer. So, in the MD examinations, there are three types of questions which are asked. One is a very long question, that is the first question in most of the universities. Although in the group I have shared the bank of Delhi University and also of IGMC Shimla. While going through the questions, I came across I have also been through the questions of the colleges from UP and from MP and also from Tamil Nadu, though I haven't been able to frame the Q bank. Yet, the common thing was that there is a long question followed by a medium sort of question, and then we are having a short essay writing. Okay, so firstly, we'll be looking into the long question. Long question usually carries 16 marks to 20 marks, it varies. However, if you have to look into that, 16 marks means minimum one should be able to write 6 pages both the sides. So it will be around 10 to 12 pages for 16 to 20 marks of question. Now, how to deal with it? See, before trying to crack this, if you consider yourself to be an examiner and if you have to check an answer, what you will be looking through, that is minimum of 8 to 9 highlighted points that are written in that answer. So for example, if you are checking an answer of a student and that question carries 16 marks, so you have to look minimum 8 to 9 points on which you can give a maximum of 2 marks each, so it becomes easy for you to check. Also remember, the examiner will be checking your answer sheet mostly on the day when your Viva will be conducted. So they don't have much of time. They have a very uh, short period of time in which they have to go through the whole question, and then they'll be checking the answer sheet also. So the idea should be to actually present those kind of headings directly to the examiner, so that they don't miss out anything, and they are forced to give you at least 1.5 to 2 marks on each of the question that you are each of the topic that you have written. Fine. So, for example, if I have to write an answer on TRS, that is treatment resistant schizophrenia, what I would do prior to writing any of the answer will write that, okay, answer number one, treatment resistant schizophrenia, in the bracket will write TRS, will be discussed under following headings. So, before writing a long question, itself you mention that you will be discussing this question under following headings. For example, as far as TRS is concerned, it can be written down as definition of TRS, criterias of TRS. Again, in the criterias, you can write three hyphen Keynes criteria, modified Keynes criteria, TRIP guidelines, Brenner's criteria. So these are the four type of criteria that you can write. Following which you can write the treatment option or modalities available for TRS. Again, you have to write about clozapine. So again, you can write a short hyphen clozapine. Then after that, you can write clozapine monitoring. Again, there are two set of guidelines, both given by the UK and by the US. You can mention that. Following that, what you can do is then you can write the various augmenting strategies for clozapine. So if we look for this question only, what we have done is like we have written down the definition, we have written down the classification, also we have mentioned the criteria has been mentioned. We have mentioned the treatment guidelines. We have also mentioned how to monitor clozapine and the augmentation strategies. In the augmentation strategies, you can write again, make three or four hyphen that augmentation with antipsychotics, augmentation with antidepressants, augmentation with various somatic methods, that is RTMS, TDCS, or ECT, and lastly through non-pharmacological method. So again, the if you look into the number of headings, it's around 6 to 8 headings in which you'll be going to deal this question. So this should be written prior to your answer, and your answer should be in the same flow. Apart from guiding the examiner who will be checking your answer sheets, it's a guide for you also, that you don't miss on any points. So whenever you'll be turning your pages, you'll be coming across these set of headings, and again you'll be restricting yourself. Okay, fine, I have to write these set of topics, and you'll be able to answer that question in minimum of 10 to 12 pages, that is 6 pages back and forth. As far as timing is concerned, don't try to exceed the long question more than 45 minutes, maximum 50 minutes, because you have to attempt every single question. In most of the universities, the short questions, that is the last section, there the option is there to choose out like four questions out of the five. But most of the times they won't give any option. So I hope this part is clear. If it is clear, just let me know in the chat box. I am able to. Okay, fine. We are able to get a few of the responses. So Shravani, Shoaib, Raghav, Ravi, fine. So this part is clear. So for long questions, we are done. It will be taking around 45 to 50 minutes, and again the heading should be mentioned prior to writing like the detailed answers. Okay. Now let's move to the second type of question, that is the medium type of question in which you have to write. Now you don't have to write 10 to 12 pages. That is, you don't have to write 6 pages back and forth. Max to max you can write 3 pages back and forth, or 4 pages back and forth, for the medium set of questions. Again, in this set also, what you can do is, prior to writing a question or answering it, mention the headings. Again, it will be a guide for the examiner and also for you. In this, make a bit less, like the number of headings should be less. Like, for example, when we discussed TRS, we have made a number of subheadings also. So it was a quite detailed form of answer writing. In medium set, you don't have to write that in detail. You have to be a bit more towards what has been asked. For example, if someone has asked, if the question is management of bipolar depression. See, management of bipolar depression, it can be written as a long question also, it can be written as a medium set question also. When we are writing in the long set or the long question form, definitely you can start with the definition, you can start with the treatment, with the criteria. We can start with what is given in ICD, start with what is given in ICD and DSM. You can compare it, you can write the nosology of it, you can write the outcome, then you can go with the treatment, both pharmacological, non-pharmacological. Okay, but here in the medium set, try to restrict yourself and answer what has been asked. Like, for example, if the question is write the treatment for bipolar depression, you can start by writing that the treatment for bipolar depression will be discussed under following headings. You can make a chart, okay, or you can make a table that pharmacological, non-pharmacological, make two arrows. So in the pharmacological, these are the agents that you'll be discussing, and in the non-pharmacological part, you can write the various agents. Apart from that, you can write the somatic treatment modalities like the MECT and the RTMS that you'll be discussing. So make a chart right in the beginning and write that the answer will be discussed under following headings. So here also we are making a list, but the list is less detailed as compared to the longer, to the long answer ones. I hope this part is clear. Okay, here also write the question in the same format, but the headings will be less as compared to the long question. I hope it is clear. I'm waiting for your responses. I Meanwhile, if you are having any doubt or if you want to ask anything, you can ask in the chat box. I'll take it up. Okay, now this is for the answer writing part, the long question and the medium set. For the short type question, that is, you have to answer four of them. These are the short notes that are there. You don't have to write the details or the headings prior to writing answer. You can write directly as you have been writing throughout your school time, in your board exams, and also when you're giving your 12th exams. The same method can be used. However, try to mention that answer in the bullet points form so that the points become itself self-reflective of the answer. Okay, like in the short note, for example, you have to write, if I give an example, write what are the various kind of pre-ECT investigations to be done prior to giving ECT. So you can write the various kind of investigations are as follows: complete blood count, pre-anesthetic checkup, what they do in pre-anesthetic checkup, how are, like what are the other tests that we actually advise for, and then it will end itself in maximum two, in maximum 1 pages back and forth. That is a total of two pages sufficient. Okay. As far as diagrams are concerned, as asked by Elsa, yes, you can make diagrams. Try to make diagrams in a very simplistic manner. Nobody is expecting you to draw a very artistic diagram. It will be a very line diagram kind of thing, very simple. Try to label the diagrams, and also remember to write just after the diagram, just beneath the diagram, you have to give that what this diagram means. Like for example, if you have drawn a circuit, for example, you have drawn a circuit of basal ganglia, and you have mentioned the cortex, striatum, globus pallidus, subthalamic nuclei, thalamus, and you have labeled it, then write a schematic diagram of basal ganglia circuit with various connections. This part has to be covered in box or highlighted so that the examiner actually knows that what you have drawn. He or she might be knowing that you have drawn a basal ganglia, but the purpose and the naming of the diagram should be done. Otherwise, it won't be making a good impression on the examiner. I hope it is clear. Shravani, we will be coming to the note making part just after this. Like we'll complete the Viva part and then we'll be coming into the note making part. That what are the various books or the options that are there, and also the note making part. Okay, fine. Coming to the Viva now. See, Viva is a very tricky kind of exam in which how you perform on that day decides your fate. So, as far as psychiatry is concerned, there is a long case, there is a short case, there is a grand viva which includes the table viva also, and then there is a neurology viva. So a total of four different kind of exam, uh, four different types of vivas are there in that same single day. So some of you might be starting with the short case, some of you might be starting with the long case, or some of you might directly go into the neurology section and you'll be examining the patient, doing all the neurological examination. So it depends like what kind of viva. Okay, so Ravi, you have asked regarding we should restrict to only schematic diagrams. Then you can draw schematic diagrams. Well, as far as the diagrams are concerned in books, also they make it very colorful. But in the exam, you don't need to color it up. You can draw a simple line diagram or schematic diagram that will suffice, because there is always a time crunch. Because if you have to write a long question, you have to write two medium question, and you have to write four short answers, then definitely time is something which you have to look for. Because if you try to incorporate too much diagrams, what will happen that even though you'll be answering a single, you'll be making three or four diagrams in a question, on only a single question will get completed. So try to restrict yourself and make two diagrams if possible, not more than that. Also, diagrams should not be too much like it shouldn't cover a whole of a single page. Try to restrict yourself, make half a page of diagram, and then in the half of the page you can draw the arrow, label it, write what the diagram means, and like you can, as I gave an example about the basal ganglia, you can write that this is a schematic diagram of basal ganglia describing various connections. So uh, line diagrams and flow charts, table and schematic diagrams, they are pretty good and handy as far as exams are concerned. Now, Vaishak has asked this question. In Telangana, we have all 10 marks questions. So we don't have short questions. So for hardly 20. Yes. So again, if you have to write 10 marks question, you have to, like, so for example, you have like a total of 180 minutes. So in 180 minutes, if you have to write 10 mark question for each and every question, you're getting 18 minutes. So in that 18 minutes, you have to complete that question and move on to the next question. Same goes for each and every question. So there is always a time crunch. You can't exceed even 5 minutes on a single question. If you're giving it, you're bound to miss on the last question or the second last question, or for that matter, whatever question is there. So what you can do is that as far as 10 marks questions are concerned, again, I'm saying that you can restrict yourself to 2.5 pages, means 2 pages back and forth, max to max, that can be written, or you can write 2.5 pages, like means 5 pages in total. 5 pages means one page back and forth, second page back and forth, and in the third page only the front side. That's the max that you can write. In that, again, if there are some questions that you feel like that instead of writing paragraph form, you can write it in point wise, try to write in point wise manner. If possible, try to incorporate smaller and less complicated diagrams. You can use flowcharts, that would be good for you. For all the Telangana people, the residents out there, you can use this approach, that write it flowcharts, make appropriate diagrams, smaller diagrams, self-explanatory diagrams in which you incorporate small details in the diagram itself. But after the diagram, write it in detail that what the diagram means, which will be good for you because you have to write 10 long questions. Okay, fine. Shoaib Khan is asking that we can take questions in the later part. Okay, fine. I'll take up in the later part. So in the Viva, as we were talking, so Viva actually comprises of four different parts: long case, short case, and the neurological examination and the grand Viva. So long case. So among this, if you ask, everyone will be worried regarding grand Viva. That has to be the most impressive one. It has to go well, but always remember that your long case is something which is a game decider. If your long case is fine, if you're done with your long case, uh, more than half of your battle is over for that day. So, see, examiner doesn't come there to check your knowledge. Knowledge checking part is only restricted to 20 to 30% for that examiner. Also, it varies from examiner to examiner, but still, nobody is coming there to check your factual knowledge. Nobody is coming there to check how much you know, how much facts you know, whether you have, uh, mugged up whole of CTP, whole of synopsis. Nobody is going to examine you on that basis. The examiner examines on the basis of whether you are able to elicit the psychopathology of the case, whether you are able to write it properly, you have done a proper diagnostic formulation, and you have told the correct management. So in the long case, if you have done fine, if you have done good, and you are done with your long case, always remember that your half of the battle has already been over. So focus on your long case. Don't mess it up. Take your time. Usually 45 minutes is given for you to write the long case. Be cool, be calm. See, it is just like another OPD workup in the OPDs. This is why I have been focusing to my residents also, where I am an SR, that in the OPD, take cases, make a time frame of 45 minutes, try to complete your workup in 45 minutes, and when you are done, just present what you have written to the teacher or your faculty, so that you get to know that what aspect you are lacking. So most of the residents, what they do is like they avoid working up the cases in the last part of their residency. But again, it's a fair advice that we also, like we when we were residents, we were doing daily OPDs or a single case a day, and presenting it that in the given time frame of 45 minutes to our faculty, and then they'll be asking questions. You can also request your faculty to hear it as an exam case, so that it will be more like an multiple like you'll be presenting the same you'll be presenting the case in the same format again in the exam, so it won't make a bit of difference. Also, the anxiety will lower down during the exam time if you have presented it multiple times, instead of looking into what other colleges are doing, what your residents from other colleges are taking, like how they're presenting. Focus on what is going there in your college. Like for example, in MSc, for example, what as far as affect is concerned, at AIMS we used to describe it as subjective, objective, reactivity, congruency, range. But in some of the colleges, what they do, instead of writing subjective and objective, they write mood and affect. So don't get carried away. What has been following, what the residents of AIMS are following. Follow the headings and the method which is there in your college. Don't try to do something new. Also discuss among yourself that what kind of headings you will be writing up in the exam, so that all of the residents of a single college they write in the same format. Don't try to write something else. uh, what will happen that when the examiner will assess, they'll be assessing each and every one of you, and when he'll be able to notice some kind of difference, then again he'll be asking you question that, see, others have written like this, why you have written like, why you have added up this single topic or something like that. So better to avoid these kind of discrepancy. Decide among yourself, sit down one day, write down the format in which you'll be writing the HOPI, in which you'll be taking up the long cases, the headings in which you'll be writing the MSc, and the method or the way by which you'll be presenting your diagnostic formulation and management. It has to be the same with all the residents of a single college. Try to make it uniform so that to avoid any kind of discrepancy and unnecessary questions which will be asked by the examiner. Fine. Also in the Viva, before the Viva, you can definitely read a bit about whatever your cases are. Like for example, if you got a case of schizophrenia, what you can do is always and always the question will be there on management. There will be questions there on the non-pharmacological management. And if you just think, definitely they'll be going to ask, as of now, what are the changes from ICD 10 to ICD 11. DSM 5 they can ask, they cannot ask, but the changes from ICD 10 to ICD 11 is a must. I are 90% of the times the examiner are concerned regarding these set of questions. Definitely you have to know who has given the term schizophrenia, what are four A's of schizophrenia, what is type 1, type 2 schizophrenia, what are the NICE guidelines, what are the IPC, the CPG guidelines which are released by IPS. So minimum these two guidelines, these set of questions, what are negative, like what are the various dimensions in which schizophrenia is now been discussed in ICD 11. So all these set of questions should come up in your mind for each and every case that you present or you read while discussing it with your colleagues. Try to frame these set of questions because these are the very common set of questions. Examiner won't ask you something out of the blue or something out of the universe. They are going to ask you same thing that you have read. The only difference will be that you are not that you won't be doing the workup in your OPD. You'll be doing your workup on your exam day. Rest, everything will be the same. So believe in yourself. You have read well. Just try to be calm and composed. You'll be able to recall everything. Same thing for this short case also. Sorry, one thing I forgot to mention in long case in MSc, if you have to write sample, don't miss to write the sample of insight. Don't miss to write the sample of neutral free flow speech, because each and every time if they ask, and if you haven't written the sample, and if you have given a sample, a made up sample by your own, they'll be able to catch you that you haven't written the sample, because the sample will be changing each and every time. So don't think that they are not going to judge you on that. So try to write down the sample if possible, or you can do the arrow diagram for the sample during the main exam. If you try, if you do it on regular basis in your OPD, you will be fairly able to deal it. You won't be having any difficulty in writing the samples. Okay. Coming to the short case, the main focus is on the elicitation of psychopathology and the related question. Here, the short. So, if you're done with the long case, as I've said earlier, also most of your Viva is total is already over. Now, in the short case, the focus is on the management part either, or they'll look into the psychopathology or how you have done your MSc. So, be thorough with your MSc definitions, be thorough with your psychopathology elicitation. Read about what psychopathology you have been writing up in your MSc. Try to read the definitions of that. Try to read various allied topics related to it. Like for example, if you have elicited delusion of persecution, try to recall the definition of delusion, various vectors of delusion, various type of definitions that were given both in fish by Jaspers, and also as far as delusion is concerned, try to remember the types of delusion. So these are the set of questions that are definitely they'll be asking you. Don't forget to recall the defense mechanism in psychosis, in OCD, in anxiety. What are the various set of defense mechanism that are used by the patients? So in short question type, or in the in the short case, these are the set which are being mostly given attention to. Okay. Now in the grand viva, if you are done with these two, then you are left with your grand viva and neurological examination. So in the neurological examination, practice it in your with your colleagues. Mostly they'll ask you to elicit one of the uh, deep tendon reflexes and one superficial reflex, or they'll ask you how if a case of stroke comes, what is the management. So they won't ask much in detail, but two topics that should be read is how to elicit the deep tendon reflexes, the superficial reflexes, and the elicitation of the trigeminal nerve, the facial nerve, and the vestibular nerve. This is important. Okay, 5, 7, 8 cranial nerves and the reflexes. As far as grand viva is concerned, if you ask me, they can ask anything ranging from psychology to EEG to drugs to various kind of batteries to various kind of scales to various type of topics. They can jump into anything. So grand viva is something which you can't predict. It can go in any flow as the examiner want. That is why I'm asking you to focus more on something which you can control or which you have more grasp. That is long question, the long case, the short case, and the neurological examination. Grand viva becomes a very ambiguous set of exam where you don't know what will be asked to you. So yes, you have to read each and every part, each and every topic, but do give focus to long case, short case, neurological exam, and then as far as the time is there, when you have done with your residency, 3 years of residency, you'll be able to recall some part of something, some like you'll be able to answer fairly well if you have done, if you're reading regularly for past couple of months. So you can't predict about the grand viva. I think we can move on to the next section. Just let me know in the chat box. So for preparing examination, time is something for which you have to fight with and for. So daily from now onwards, if you study daily 5 to 6 hours of reading is something which will be sufficient for you to actually complete your syllabus. Try to read topics instead of reading each and every question. Club your questions which are being asked in last 5 to 6 years into a specific topic. For example, the same set of question which I have described earlier, like TRS can be asked as short note, also can be asked as medium form, medium note also, as well as long in the long notes also. So again, instead of reading TRS for 3 times, you can club up all these questions into a single topic. Then you can read it in a single go. Notes making, again, see if a question gets repeated multiple times. Now, like in many of the, I'll take up the question in the last segment. Okay, Ravi, I think we can wait for that. So in the note making, what we can do is like if you have to make notes, try to make notes of something which has been regularly asked. For example, neurotransmitter. Neurotransmitter is something which they ask in every examination. You can pick up the question papers of last 10 years or last 20 years. Each and every exam will have a single neurotransmitter where they'll be asking the synthesis, the various kind of receptor, and its importance in psychiatry, treatment, as well as the illness part. So again, neurotransmitter becomes one of those topics which a note can be made. Handwritten notes of your own is something I'll always say that it is the best and it can't replace anything else. You can read from various sources, but if you have made notes of it, see, the notes shouldn't be something which has to be beautiful, which has to be organized. It can be written down in a notebook, in a piece of paper. The only thing is that whenever you have time and whenever you have to revise it from that same source. Importance is of the same source, not of multiple sources. So if, for example, many of the residents, what they do is, like, if they have read neurotransmitters from Kaplan and Sadok synopsis, they'll read it from CTP also, they'll read it from some other books like Oxford, they'll read it up from other biochemistry notebook also, uh, biochemistry book like Leninger, and then ultimately when the answer writing part comes, they'll be mixed up with a lot of information. It will not be streamlined. So to keep it simple, what you can do is you can make a note of all those set of questions which are repeatedly been asked. Try to jot down the points in the same order as I have told for answer writing. That is, you can make the headings and then again you can write the note. You don't need to make notes for everything. Mostly the questions which are asked commonly and routinely, which tends to get repeated, make a note of that. For most of the questions, what you can do is you can do marking itself in the article or in the note in the textbook, or what you can do is, like, you can make very small kind of sticky notes so that you can remember the important points of that topic. Now the third point is teaching. So if you have a group study group, this works for that. Like, if you have read a topic, if you have completely made notes of it, you are well versed with that topic, try to teach the same thing to your fellow mate. And what will this thing do? Actually, it will be an active process. You'll be able to revise your own thing. You'll also be able to realize that there are some points which has to be cleared, so you'll go back again after teaching your fellow mate, you'll read it again, and you'll be well versed with it. It will be totally registered there in your brain. This can also be done whenever, like, for example, if you meet in the evening time and in the daytime you have read it, try to explain each and every topic in small, like, for example, 5 minute discussion on TRS, 5 minute discussion on TROCD, 5 minute discussion on various theories of psychology, like theories of emotion, theories of memory. It hasn't be a single long hour, 2 hour kind of discussion. 5 to 6 minutes or 10 minutes discussion is itself good. What this discussion will do is, like, it will point out various points which are still has to be cleared. You will go back, you'll read those points again. When you'll come back, you'll be able to tell to your fellow mate, okay, these are the points which I left while discussing the topic yesterday, and again I'm telling you. So by doing this also, some of the residents are able to revise and recall and register. So you can try this part also. I think we can move forward. Now comes the goal. So the goal of exam, so there are two kind of goals, which some are achievable goals and some are expected goals. So achievable and the expected goal, both the goal is to pass the exam. Some of you might be wondering that I have to achieve gold medal or I have to achieve highest of the marks. Those, it depends upon your performance, on how you do well in your Viva, how well you are able to write. So try to do those things which is there in your hand, which you can control. For example, what you can control, what you can do is preparation for the exam. What you can control is you can revise the number of topics 2 to 3 times. You can cover as many topics as possible, or as many topics which have been asked previously in the exam. So try to keep it simple. It is just an exam. The only difference is that it's a pen and paper exam. You have to write it down, and also the Checking will be done on the day, mostly on the day when the Viva is taking place. So you have to keep it simple, clean, make it presentable to the examiner. That will be sufficient for you to pass the exam. Just don't write something rubbish or something which doesn't make sense. Try to read. Most of the things are overlapping. Some of the things you know it while you have done your residency, so you don't have to panic. Just try to present your information in a representable manner and in a very clean and neat manner. Now this is something very important, like for exam preparation. Residents are always worried regarding which books, which notes, what guidelines to cover. So as far as the books are concerned, you can look for synopsis. Kaplan and Sadok synopsis is one of the a good book. You can also look for Oxford textbook of psychiatry. You can also look for other books which suits you or which is there running in your institute. There are some Indian author books also. I think Ahuja is one of that book, and one book by Dr. Khimere is also there. Okay, these are the main books that you can focus on. However, there are also other exam preparatory books, like for example, Tips is one of those kind of books. Then there is one book by Sijo Alex. Okay, so these are the various kind of books. Again, I would emphasize on this part that don't try to read too much. Try to read one thing from one source and try to read it multiple times from that source only. So, for example, if you have read things from CTP main book, try to read that same thing from that source only and write it down in a piece of paper or in a sticky note that this part has been read from this book, so that at the end you don't mess up. Okay, as far as books are concerned, I would again say that stick to the classical textbook instead of going for tips, instead of going for other books that I have mentioned. Like there are exam preparatory books like Tips, Sijo Alex. These books are there, but these are having very less content. The content is very outdated also, and they are not in a very structured manner. Your notes are the best. Your textbook reference is something which you should rely on. Try to make some notes. Try to incorporate notes from your from what you have read from your books, the standard textbooks. Okay, as far as guidelines are concerned, this is something which I want to discuss today. Like for example, if you haven't read anything, for example, if you haven't read about schizophrenia, or like for example, let's take another disorder, like for like you haven't read anything about conduct disorder. So what you can do, if you don't have time, if you have only 2 weeks left, a week left, or even a single day left, you have child psychiatry examination. Usually paper three covers child psychiatry in most of the university. What you can do, you can pick up the CPG guidelines which are released by Indian Psychiatric Society. What you can do is you can just read the whole guideline. It is hardly 4 to 5 pages, that is 2 pages back and forth. There, right from epidemiology to clinical features to assessment and management has been given. So, if you have crunch of time, if you don't have time, if you have very limited time, and if you have a number of topics to be covered, don't panic. There are guidelines. You can switch to them. Those are all released by IPS CPG. You can go to the site, you can download it, you can get a print of it and read it from there itself. Okay. So instead of going for textbook or making notes, as time is not there, read these guidelines. I would suggest that each and every topic that you read, for example, if you have read OCD, if you have read anxiety disorder, try to look into the CPG IPS guidelines that has been which explains the management and the assessment parts, because most of the examiner are well versed with these set of guidelines, and they want you to answer in the same manner. Okay, Elsa, Matthew, yes, Tasman is one of those books which you can definitely refer. I forgot the name. So, Synopsis, Tasman, CTP, Oxford, these are the set of books that you should refer to. These are the golden books or something called as the standard textbook for exam preparation. Synopsis, Alan Tasman, Oxford. These books you can definitely give a read. Out of these three, Oxford is a textbook which is very written in a very lucid manner. Alan Tasman again is a very nice book. Covers a lot of table. It covers a lot of flowcharts also. Synopsis again, it has also good representation of various information in form of charts, in form of tables. So it's up to you whatever you want to choose, but try to keep it a single source. Okay, instead of going into multiple notes which are there in uh, see. And also one important thing, that even if you read a topic from a book, try to like for example, if you get some notes or some kind of PPT in the WhatsApp group or in the Telegram group or in any source, you have to have a reference. So like you have seen that whatever information or whatever document that I share on Psych group, it's always associated with a reference, because it has to have an authentic source. Without reference and source is always in a doubt. Okay, I can't say anything and it will be true. It has to have a reference. So even if I'm saying a single word or a single sentence, it has to have a reference for the authenticity part. Why I avoid or discourage residents to follow the presentations which is there flooded in the online medium is that most of them, they are unorganized. They don't have any standard reference, or the references are all outdated. So try to focus during your exam preparation. Focus on your notebook, make notes from that, take helps from the various kind of notebooks which are available. But again, they all have to have a reference. Standard reference has to be there. Don't try to mug it up because it has been written less or it has been written in a very lucid manner. Do read it up, but again, read back the standard textbook. In shortage of time, when you don't have any time left, it's just a week or a day left, follow the guidelines, that is the CPG IPS guidelines or the NICE guidelines. Maximum, you are done. For mood disorder, I like to add on that you can read CanMat guidelines too. Okay. Rest of all, for the child psychiatry, CPG guidelines suffices. For schizophrenia, mood disorder, OCD, for mood, read CanMat. Apart from that, for OCD, anxiety, schizophrenia, NICE guidelines and CPG IPS guidelines, they are something which you can go with and it won't be having any problem. Okay, fine. I think these are the sources which I have to tell you. Now, again, uh, as you know that we have a Instagram channel also. So chapter wise notes have been covered. If you go to the scroll up back to the main channel, you go there, you just try to scroll it down and look for the first post, and then you come to the latest post. As you move upwards, see, schizophrenia has been covered in first 40 slides. Next, mood disorder have been covered in the next 40 slides. OCD has been covered in the next 40 slides. Also, we have released a PPT of OCD with you. We have released a PPT of TRD with you. Those things, if you ask me, I can give the articles also. Each and every post in my Instagram, they have a reference written to it. So it is nothing that you can't read it and you can't quote it. Reference is always there in each and every post of ours. Also, whatever PPT I have released, if you want, I can give the reference article while making those PPT or making those documents. Most of the times I have been able to incorporate it. However, if I have not, you can ask me in the group, I'll send you the original article. So whenever you're bored, you can definitely come back and look at the Psychiatry Instagram channel, and you'll be able to get catch hold of multiple topics which you find boring while reading it. So now we'll be coming to this part, the case report and the series part. But I think someone requested that we can discuss this later on, and we can discuss this part, that is the post MD plans. What are the various kind of options that are available post MD? Okay, Shravani, I'll take your question once we are done with this. Fine. So post MD, what you can do is like starting, you can do DM or you can do PDF. DM courses is usually of 3 months. DM courses is there in NIMHANS, in AIMS, in PGI, Chandigarh, in KGMC. Also, a number of other institutes have come up with respective DMs. However, if you see the popularity of DM, child and addictions psychiatry and geriatric psychiatry are these two DM options which are very much popular. In PDF also, PDF is another a year and two. Like for example, in NIMHANS the PDF is of a single year. Okay, 9 months to 12 months is the duration of PDF. PDF child psychiatry, neuromodulation, adult psychiatry in schizophrenia mood, and in CL psychiatry. These are the kind of PDF usually for which residents look for. In PGI Chandigarh, CL psychiatry PDF is of 2 year of a single year, but they ask 2 years of senior residency to be done. So post 2 years senior residency, you will be able to do PDF. In demands, you can directly after writing your MD exams. Once you are done with it, you can write the exam, crack the exam, and get yourself enrolled in a PDF course. It's of a single year. So some of them actually go for DM options or PDF options. Again, if you ask me, as far as the clinical knowledge is concerned, psychiatry is one of those branch which you can learn throughout your life, and adding on a degree if you want, you can definitely go through. It is something which is not mandatory. So like for example, in pediatrics, now we are seeing that people are doing DM neonatology, DM pediatric rheumatology, pediatric gastroenterology. The need of the hour is not like that we have to do DM child addiction, we have to do DM child or DM addiction or DM geriatric psychiatry to survive, because these are all optional kind of degrees which you can do. Okay, so what will happen is that if you want, you can do them. If you don't want, fair enough. There is nothing mandatory you can do. The only mandatory thing as of now is to do your pass your MD exams. Post MD, you can have multiple options. Fine. Now we can go with the senior residency as usual. That after passing your MD exams, you can opt for senior residency. Senior residency course usually, see, again, it is on ad hoc basis. It is on regular basis. So on regular basis also you can do for 3 years. On ad hoc basis also it will be renewed after every 6 months to, like after 6 months they release it again, a notification will come. So again you can do it in that manner also. Like you can do ad hoc basis senior residency or regular basis senior residency. My take on senior residency is avoid doing it from your own MD college or your institute. Catch try to go to some different place where a different setting. Like for example, if someone has done their senior residency from IBHAS or for example CIP or NIMHANS, they should go and look to do senior residency from a general hospital psychiatric unit. Also, if someone has done from AIMS or PGI, they can go and look to do their senior residency at a mental hospital setup. Also, there are people, and I prefer that kind of option also, like doing a year of senior residency in some college or institute, then move on to some other college. Then, when by this, you'll be able to learn various different perspectives. Psychiatry is one of those branches in which perspective do matter. Every person, every consultant, every faculty is different. Try to learn why they are doing so, what is the rationale behind it. So senior residency should be planned. It is not something like a junior residency or a postgraduate residency. Senior residency, in which in senior residency you learn how to manage case. You are the manager, case manager of a single case, or around 10 to 12 cases or 10 to 15 cases at times. You have to decide the treatment, the therapy, the somatic therapy, the kind of medication you are giving. You have to make the junior residents work. You have to listen to their history. You also have to conduct your exams. You also have to look forward attending various kind of seminars. So senior residency itself comes with a different set of responsibilities. It definitely helps an individual to grow. It also helps them to actually find what uh, like a kind of skill which might not be there in junior residency, or it has been suppressed because of the ongoing stress of passing the exams with or doing the MD program. Senior residency, there is no compulsion that you don't have to attend an exam, so you can definitely develop your skill. You can also look forward what do you like to. This should be done. Again, it varies. If you have to go into clinics, that is the third part, maximum 6 months to a year of senior residency suffices. Again, you can continue up to 2 years also. 2 years of senior residency is fine if you have to start your own clinic. If you want to go into academics, you can either do the DM or the PDF courses, or you can do a 3 year of senior residency and do some research kind of work. So again, it varies what you want to pursue in your life. Based on that, senior residency or DM PDF courses should be taken. It's not like if a friend of yours is doing a DM course, you should do it. It is totally your decision. If you want to do it, you can do it. Else, it is your call. There are people, there are friends of mine who have done their MD from AIMS and now they are into their own clinics. They are doing fairly well. They have spent a year in their clinic and now they are able to see daily patients. So it is not like that if you miss on senior residency, if you don't do DM PDF, you'll be going to miss out on anything. It's totally on your own caliber and your own way of dealing with the patients. If you are into academics, if you want to get a job in a government institute, if you want to become an assistant professor over there, nowadays, as far as psychiatry is concerned, DM is something which is mandatory because your competitors or the people who will be applying for that job will be doing DM. Again, if you want to join a academic institution senior residency of a period of 3 years in union territories and 1 to 2 years in other states suffices for you to join a government post in a government medical college like an AP. If you have to start your clinics, restrict your senior residency to 1 year at max, or you can go up to 1.5 years. Nothing is required. Establishing your clinic, again, clinics can be dealt in three manners. Number one is the corporate clinic. You can go and get yourself enrolled in any of the corporate clinic, be it Max, be it Apollo, or be it a very famous kind of hospital which is there in your city. You can get associated with that. Number two, you can give your time to a corporate hospital. Side by side, you can run your own clinic. This is the best thing that can be done in the initial days when you are beginning to look up to your clinics. The third thing is that you can liaise with a number of hospitals. You can also liaise with them and you can start your clinic. So instead of going to a single hospital, after spending 3 to 4 months, you can liaise with multiple hospital, and accordingly you can set up your days so that patient can visit you there. And but the mandatory thing is that you have to run your clinic daily in the evening time or in the morning time as per your choice. Okay. As far as research is concerned, you can the options of research in India is very much limited. In research, there are various options available. You can be a research fellow, but the institute which provide them are AIMS. You can do your research in PGI Chandigarh. You can do your research in KGMC and NIMHANS, of course. But here, as far as the research is concerned, most of them are already pre-decided. So if you have something in your mind, you can go out. You can look for an option outside India. Uh, One of my friends, again, my batchmate, just after completing his MD, he's also there in our Psych group, Dr. Pauly Shetty. He went abroad. He's currently in London and he's doing his research in one of the institute over there. And because, see, research in India is pretty much limited to the social psychiatry part. Mostly it is the application of a set of questionnaire scale assessing it. Hardcore real research goes very less in India. You can definitely move outside and definite and you can pursue your zeal to do research. Another option is to take a break post MD. If you're exhausted, if you feel that you need break, take a break for 2 to 3 months, unless and until there are options available. Like for example, many a time senior residency post it takes some time, so you can take a break of 2 to 3 months. Again, I have all live examples. My batchmates were there. My one of my batchmate took a break of 6 months and then he started his senior residency. So I'm lucky enough to have all set of friends. One is doing DM, like person like me who continue with senior residency. There are friends of mine who are doing directly into clinic. Some of them have went for research. Some of them took the break for 6 months. Another option that you can go outside. Now the problem with going outside is that you can go to multiple countries. If you look, you can go to UK, you can go to Europe, you can go to Australia and New Zealand. Okay, now the only thing which has developed in past year or so is that the payment in NHS and UK it is less as compared to what a psychiatrist get in Australia and New Zealand. So if you are planning, do plan for Australia and New Zealand. Life standard, definitely UK is having a better life style and life standard as compared to Australia, but Australia is not, never it is nothing that it is lagging behind. Pay wise it is better as compared to UK. The only issue is that you have to clear the MR Psych exam to get registered as a permanent member in the Royal College. There also you have to be like the payment for your job is pretty much less as compared to what you will get in Australia. Okay, and directly also after doing your post MD, a single year of senior residency you can do, and you can also crack the IELTS exam, and there are multiple agencies which hire you. But always remember the expenditure and the cost, it does matter a lot. Okay, if you want to settle over there, you can crack the licensing exam of the university or of the country, and you can get yourself registered as a practitioner over there. Another option is Dubai. You can go to Dubai. Dubai Healthcare Services is there. You can get yourself registered. You can work as a psychiatrist or clinician in Dubai. Dubai also pays you fairly well. Some of them, some of the psychiatrists, like they're senior to me, but they have done some part of their practice in Dubai. They have earned a lot, and then they have come back, and then they have established their clinic in India also. So that is another option. See, Australia and New Zealand, what the difference knows for if you go into the Royal College of New Zealand and Australia, they are having a single set of examination. You have to make an option. You have to select what colleges or which part of the country you are looking for. So the uh, the governing body for Australia and New Zealand is a single body, the RANZAP. Like we have the Royal College of Psychiatrists in Europe, sorry, for UK, you have RANZAP for Australia and New Zealand. Okay. So, do we get a salary in PDF courses? And sir, what is your take on taking a job as a specialist in a government setup? So, again, Ravi has asked this quite a beautiful question. So, salary in PDF, you'll be getting salary in PDF. The PDF payment is low as compared to DM. Also, joining as a specialist in government setup, it again depends upon what do you want to do. If you want to pursue a course, like for example, if you want to become a consultant, and if there are chances, because the seats are very much limited in government setup, so if you crack the UPSC exams, like if in Delhi, in Chandigarh, in various UT, there are quotas registered or there under UPSC for you to get selected as a faculty. So if that is coming up, you can work as a specialist in either of the institutes, in whatever institute is there for some time, and then you can apply for a government post of an assistant professor. Then you will get yourself promoted after a period of 3 years to 4 years, depending on the state. What happens is that there are people who actually look for the specialist course. But if by chance the post for AP assistant professor doesn't come, the same post get renewed, and you will be staying as a specialist for a longer period of time. So this case has been there in Assam also, in other states also, where the regulation of the recruitment of faculty is not that smooth. These kind of problems are there. So if you join as a specialist, nothing bad in that. The only restriction of a specialist is that he or she is not allowed to do the teaching part. The rest, management of clinics, OPD, all things can be done. I think Sid, we have covered about Middle East, Dubai, Qatar, and Oman. These are the three countries where you can actually go and make good amount of money. If you want to settle over there, the registration or getting a residency in UAE, it's not allowed. For Oman and Qatar, you can go and definitely get settled over there. However, the laws are pretty much strict. For Australia and New Zealand, the steps are more in number, but definitely it's a win-win option. If you go and settle over there, you can. And another option is UK. Now, US I haven't discussed, because US you have to crack the MLE, you have to take the 4-year residency program and then license to work as a psychiatrist. So your MD psychiatry degree per se in India won't suffice. So you have to do the residency again. Okay. Okay, Vaishak is asking, is it good to clear DNB post and how is your approach? Definitely, why not? There are people DPM or diploma, and then they have done their secondary DNB. Now in DPM, once you do DPM, you have an option either to continue as a DPM, or you can do a secondary DNB, crack the exam, earn a DNB degree. You are at par with MD residents. There's nothing different. You can get the same kind of options which are there for an MD degree holder. You will, the same options are there for DNB people also. Also, if a person is getting enrolled into a DNB college or a hospital setup, doing DNB psychiatry makes him or her nothing less than what the MD psychiatry residents will be achieving. The options are nothing different. Both are the same. Either you do MD or DNB. Anand has asked, just 2 months, no study leave, will be able to make, sir? Again, I have asked, answer this question. See, if you have worked out what are the topics that are going to be asked in your exams by reviewing your last 5 to 6 years of question paper, and you have jotted down in a page, as I have done for DU and for IGMC Shimla, it gets pretty much easy. 5 to 6 pages will be there max to max, in which you have written down your topics. Read it from a note, from an article, from a good textbook. That topic you can read it from an article also, or if you have time crunch, you can read the broader disorder like schizophrenia, OCD, as I've given example from the CPG guidelines also. That will suffice. 2 months, yeah, I think that is fair amount of time that you can make through. However, you might not be able to cover everything in detail, but you will be able to cover some parts of each and every topic that will make yourself sufficient so that you can pass your exams. I think we'll be looking into the other section, that is case report and series writing. This is mainly because why I have covered this, because now NBE, the national board have made this mandatory to either have one journal, like one of your article to be published, or one podium presentation, something kind like either of that has to be there. So this is something which is very much easy and should be given focus to case report or case series writing. How to begin with? See, it doesn't matter a case, whatever case it is. It doesn't have to be super complex. It doesn't has to be one of the million cases. Okay, if you're getting something like that, go for it. But simple cases like, for example, if a patient is taking vortioxetine and she is pregnant, throughout the pregnancy she has continued vortioxetine, and when the baby has been born, examination of baby revealed no abnormalities, nothing, and the pregnancy was uneventful. This itself becomes a good case report because vortioxetine doesn't have studies during the in the pregnant population. So if, for example, if you get a similar set of patient which I have described, you can write a case report on it. Writing case report on normal cases also which you see on daily day-to-day basis is also fine. The thing is that you have to pick what is important or what is unique in that case that actually needs to be reported. Also, case report, it doesn't mean that case reports are uh, like it is the least in the hierarchy of the evidence, but based on the case reports only, you'll get higher evidences. So if you don't report it, you'll miss a chance of publication. If you start reporting it, it becomes a habit, and once you start reporting it, you'll be in the habit of seeing the cases in a very detailed manner. Okay, like for example, if one of the case report which I reported was was of methamphetamine dependence. When I saw the case with one of my colleague, uh, we both started reading about various case reports that have already been reported. So we found that all the case reports that has been reported of methamphetamine dependence was from India, and our case was the 19th case of all. So yes, it's always beneficial to write case reports. The question is how to write it down. So what you can do is that there are guidelines. Care guidelines is there for case report writing. Download the care guidelines. I'll share it in the group just after the session is over. What you can do is write your cases. You can take help of uh, already published case in IJP or in IJPM or in some kind of international journal, for example, psychiatry case reports. Okay, case reports in psychiatry, PCN. These are the various standard journals which you can take, download a case report, see how they have presented. Usually, how to write it down? The first step is to make the patient anonymous. You can write a female in her 30s rather than writing a 38-year-old female. So, simply a female in her 30s was assisted by her family member to a tertiary healthcare setup, and then you can start. Try to give minimum details unless and until if asked by the journal or by the editor. Okay, what you can do is, as you have written it down, try to write down the whole thing. Don't cut it down in the first go. If you're writing case report for the first time, write down as many details as possible. Once you are done with that, that is the case demonstration, the presentation of the case, the investigations, the diagnosis, and the management. Now see that you have to combine it up in 750 to 1000 words. Now this is the problem that has been coming up. What is happening is that in nowadays, in last 2 years, most of the journals, they have restricted their case report uh, word limits to 750 to 1000. So you have to make your case report crisp. But if you start doing it in the very first go, what will happen that you would be that you'll be missing upon important, detailed, or very crucial information. So try to write it down in a very detailed manner in the first time. Then you can definitely slash off all those kind of information which is not necessary. You can take the help of your senior resident, or you can take the help of your faculty or a senior colleague who has written the case report. Then you write it again, keeping in mind that you have to complete it in 750 words. Now what happens is, right, once you are done writing in 750 words, do try to check the grammar. Okay, what happens is, like, most of the times we tend to forget this, but in Europe and in England, they have a expert for the language, for grammar. The grammar experts are there. But as far as India, Southeast Asia is concerned, The grammar has to be correct. If the grammar is wrong, it won't get corrected. They'll just make the setting. If your case report gets accepted, they'll just make the setting according to their journal and publish it. So take care of that also. Like for example, how to select the journal, this is very important. So even if you have written a fantabulous case report, it might be possible that if you are submitting it to IGP or IGPM, it might not get selected. It's highly, there are high chances, because there are number of factors. There are other fascinating case reports, or they have already selected for the current you know the current journal. So what they can do is, like, they can definitely reject it. Or a similar case like yours has already been published 2 months back, again it will be a bad option for them to republish it. So what you can do is you can look for other options. For example, what I said regarding vortioxetine and pregnancy, this is a very good case report to be reported in some journals which deal with obstetrics and gynecology. I had one patient in which trazodone induced rashes were there, and if you submit it to IGP, the psychiatry journal, the chances of getting accepted is low to moderate. But if you submit it to some kind of journal which accepts, like for example dermatology journal, if you submit it to pharmacology journal, definitely they'll be taking it, because they're looking up cases for their drug, for their specific the example which I gave, vortioxetine in pregnancy. They are looking for various kind of drugs which are safe in pregnancy. So look out for options. The last step is the most important step. Don't miss out on it. It's easy to write case reports, then it is to select a appropriate journal for it to get, for getting it published. Okay. Raghav, I will take your question at last. You have written something. I'll just read it at last. Okay. Yes, now I'll be taking up questions. If you have any questions, just write it down in the chat box. I'll start it from right from the first. Uh, Siddharth, I have covered your question that could you please share post PG career before case series and recent reports. Elsa, I have again answered that question, that diagrams whenever possible can be drawn in all kind. No schematic diagrams, line diagrams or something which should be drawn. Shravani, any suggestions regarding notes making or theory part to first and second year postgraduate? Now, see, first and second year postgraduate, whatever cases are there in your ward, what has been allotted to you, do the workup. Try to read the same from at least a single source. You can read the big CTP, you can read Alan Tasman, you can read the large book, the large Oxford book. You can refer to these sources, or you can refer to some of the standard articles which is there. Try to make note of it if possible, or you can highlight itself in the book, or or what you can do is, like, you can take some of the important points and jot it down in your diary, and also write it down from where you have written. That would also do if you don't have that much time. So note making is an essential thing that is there for first year and the second year. If you have started your note making in first and second year itself, what it would be, it won't be a big hurdle for you at the end. At the end, you'll be having enough notes, so you don't have to worry much regarding your preparation for your MD exams. Ravi, I've answered your question. Should we restrict to only schematic diagrams then? In Telangana, we have answered this question. Okay. Sir, do we have to present only DF and management plan to examiner or entire HOPI? See, in your exams, long case, you have to present, or short case, start presenting the whole HOPI right from the start. Most of the every examiner will hear your HOPI in long case. Some examiner will ask you to present it in form of summary when you are presenting your short case. Don't try to directly jump into DF and management part. Start right, okay, start with the flow as you are presenting in your OPD and in your rounds. No need to jump up into DF and management unless and until asked about. Shravani, I think I have answered this question, but again, I am focusing back on it. So, if a first year graduate is there, so firstly read a textbook, then jump into the CPG guidelines. CPG guidelines or reading from guidelines directly, I have asked only for the final year graduates who are giving their exams if they don't have any time. For first years and second years, you can definitely have a look, but try to read the disorder first from a textbook. Then you can move on to these guidelines. It will always be better and it will make a good sense because now you'll be able to understand some of the details which have been missed in the guidelines also because they don't cover everything in detail. They are a last resort, they serve as a rescue when you don't have time, but it doesn't mean that you can read only the guidelines and you're done with it. That it doesn't work like this. Salary in PDF, I think I have done. And what's your take in taking a job as a specialist in government setup? I think there are multiple options out there. You can, if you want, you can join as a specialist in government setup. Ravi, answering your question, but again, it depends on like if you're getting a promotion to assistant professor in future, like for example a year or two, it's fine. Else it might be kind of a position in which you get stuck for a longer duration, and ultimately your promotion will be, you know, it might never happen, or it will take around 10 years for you to happen it. So it's a gamble out there. Middle East, I think I have, Siddharth, I have answered this question. Like you can look for options. UAE is always there on the top. You can go to Qatar, you can go to Oman, you can also go to Arabia. You can apply for residency, but UAE doesn't accept any foreigner. You can live as a like foreign resident throughout your life, but you won't be able to get the passport of UAE. But again, you can work there fairly for around 10-15 years. You can come back to India. There is always an option for that. Examination for Australia and New Zealand are different. They are covered by the single set of body, RANZAP, and they conduct the exam. However, the distribution is based on the marks. I can send uh, the PDF which is shared in that in their website in the group after the live session is done. Sir, it is good to clear DNB post MD, and how is your approach for it? It's your option, it's your choice. If you want, you can do or clear the DNB post MD. It doesn't add much. It will only be an exam passing thing, and you'll be getting a degree. Apart from that, it doesn't add any experience or something that would be ahead, like keeping yourself ahead from other kind of other colleagues. However, in the exam or in the CV, you can add your DNB degree. That might give an edge, but that also doesn't count much. So it's your call. If you want, you can give another exam of DNB. However, if you have done your MD, I think that is fair enough. No more need for examinations or going up for DNB. But at the end of the day, it's your call. If you want, do it. It doesn't add much. Kindly elaborate on steps of Ranzab. Raghav, I'll post this in the group once we are done with the live. Sir, APC becomes a hurdle many times. How to deal with it? That is why I have mentioned it that it is very difficult for a resident to choose which journal to submit to. So if you see PCC, that is primarily the primary. care clinicians, and JCP, Journal of Clinical Psychopharmacology, Journal of Pharmacology, IJP, IJPM, Industrial Journal. These are the kind of journal which don't ask for APC. If APC is there, do try to apply. Ask the editor for a lower middle income kind of country you belong to, and you can definitely ask for some kind of fee waiver, but hardly they'll give. Most of them, they require some kind of written acknowledgement to be signed by your head of department. You can try and contact with the editor, but it totally depends upon them whether they want to issue a waiver or not. Okay. APC up to 10,000, I think it can be fair enough. If you have three authors, you can definitely club up and pay it. Harris, I think, yeah, if you are in India, IPS membership is something that you should get it done. You can get it done during your residency. I think post residency, it's something you can do because you have to submit up your MD psychiatry degree, upload it there. So it is necessary. Definitely, it is necessary. If Because IPS is the single body which looks after all psychiatrists in India, and what are its benefits? You'll get fee waiver in each and every conference that is being organized by IPS. Also, if you're a member of IPS, you don't, if you present a paper, if you present some kind of symposium, that way you will get easy registration. Your If you have any issue, or if you have going through any of the issues while you are practicing, or while you are in some kind of trouble, you can definitely ask them. You can take help of the members out there. So there are multiple benefits of joining IPS. Do try to become a member once you are done with your MD. Is Raghav, you have asked that it is of any use to grab MR Psych if you are planning to settle down in India. If you have around 5 to 6 lakhs of money, and if you want to earn a degree by writing exam, and if you want to plan up in set up in India, it doesn't make sense. What you can do, if you really want to crack, if you want to go out to Europe or UK, if you want to go out for around a year or two, it's a good deal. You can go have an experience or exposure out there, how things are there in Europe and UK, how they practice, and then you can come back to India. But if you are just trying to settle down in India, then again, MR Psych just adds on to your degree list. Apart from that, it is not mandatory at all. Vaishak, you have asked, it is advisable to read from text soft copies or from hard copies. See, it's totally upon you. I myself, I'm not comfortable in reading from iPad or in PDF format. I get itself copied or printed out. I love hard copies. I love that feel of pencil and textbook. It's my take. However, of lately, I have started reading up on iPad also. It is also good. Most of my colleagues, they are good with the PDF, the online medium. I was the only one who was very much comfortable with the pen and paper kind of thing, or the hard copy textbook. So it's totally upon you. If you are easily able, if you are able to grasp things in PDF form, you can do it. Or if you want, if you feel that you are lacking concentration, you don't have that much kind of attention, you can opt for a hard copy also. I think we have answered every question which has asked in the chat box. Any other question that you want to ask? Okay, thanks Harris, thanks Ravi. I think we can end the live now. I hope I was making some kind of sense, and I've been able to guide you. I have been able to answer your query, and it was fruitful for you. I'll be uploading this session in my YouTube channel also, and will be sharing the link once it is done. So if someone has messed it up, don't need to worry. You can watch it down later on. Oh, thank you, Anand. I think we can end this session now. Fine. Thank you for joining. I never expected that you'll join on Sunday afternoon, but it was nice to interact with you all. Okay. See you back. I'll share all the documents and in the psychiatry groups, and we'll plan another discussion session. Yes, Sri Parno, there is a teaching series which is going on, comprehensive psychopathology series, for which we were taking 100 residents and they have enrolled for it. So this time, I think the seats are full. We'll be organizing it again in the month of Feb or March in the coming year. You can join in that batch, and definitely after the completion of this series, we'll be releasing it again. So it's a good news for each and every resident who were not able to join. Rest of the discussions which we do on psych reads, it will continue as we are doing. So no need to worry about those kind of discussions. Drug today, drug on tips, trivia, every heading that we used to do will be covered. Any other question left? Okay, fine. Thank you for joining. We'll meet soon. Bye bye.